We are going to be recording this to help us with taking meeting minutes. Let's see here. So can I get a thumbs up that you can see the screen for me? Awesome, awesome. All right. Allison, do you want to take over, or do you want me to do the slides?
It's probably easier if you do the slides, but I can do some of the talking.
Awesome. All right. I will let you talk. Oh.
Okay, I just think, good morning, everybody. I was just admitting some people. I'm Allison Schaub, and I've been with MBC since June of this year. I came on board as part-time interim executive director, and I'm glad to be here this morning with all of you. And I just thought one way to start, just to kind of kick things off, is if you want to, in the chat, you can just share who you are and where you're working, or if you're in school, if you're representing a regional coalition or a cultural coalition, and then anything kind of quirky in your Zoom room you want to share. Getting a lot of good chatting going on. And Kim, is there some official roll call we have to do, or?
Nope. Just that if they can, we'll keep an account of who all is in attendance. So not an official one.
Okay. We have 35 people participating today, and we're already in the mid-20s of comments. So, and did we want to move to the land acknowledgement?
This is Mark Spitzak. Can you hear me?
Yes.
Okay. The Minnesota Breastfeeding Coalition acknowledges that each person here is inhabiting land that has been the traditional home of Native Americans. This unceded land is home to over 10,000 lakes, and the mighty river Ojibwe people call the Father of Waters, and Dakota people call River of the Falls. This land has been home to many Native communities and is now home to 7 Ojibwe reservations and 4 Dakota tribal communities. These families have long known that breast milk is a baby's first medicine. And yet, colonialism and historical violence has broken the tradition of breastfeeding for many Native families and communities. Minnesota Breastfeeding Coalition is dedicated to partnering with Indigenous families and communities to reclaim and restore breastfeeding as the first food of choice for all babies.
Thank you, Mark. This is our current 2022 Board of Directors for the Minnesota Breastfeeding Coalition. Who all do we have on the call today? If you're able to put yourself on video, on pictures so we can see your beautiful faces, and introduce yourselves. I can
Well, I'll go
start off.
first since I was just talking. This is Mark Spitzak. I'm finishing my first year on the board as a member director at large, and I am working at M Health Fairview, coordinating perinatal and pediatric support projects. And one of my jobs there is to support lactation services and coordinate our human milk donation program with the Minnesota Milk Bank for Babies.
Corinne.
Hi, I'm Corinne Friedman Ellis. This is my second year on the board as a director at large. My background is as a pastor and political organizer, so I don't have the lactation background, but I do have the passion. Right now, I am full-time home with my kids. You can hear my 16-month-old in the background. He's being a real trooper and playing over here. I'm looking forward to hopefully getting the advocacy subcommittee restarted, which I know we'll talk about later, but good to be here. Nice to meet you all.
Anne.
Hi, my name is Ann Dorman. I'm currently in the car, going between places, and I am a nurse midwife and lactation consultant, and work at Longfellow High School for parenting and pregnant teens in Minneapolis, and looking forward to the new board members. I had the privilege of being on the nominating committee, and yeah, I love everything that Minnesota Breastfeeding Coalition does. Thank you.
I'm Kim Welvert. I'm the chair of the Minnesota Breastfeeding Coalition. I am an RN IBCLC at CentraCare St. Cloud Hospital. And then I'm also co-chair for the Central Minnesota Breastfeeding Coalition, and I'm on the board of directors for USLCA. So if anyone is interested in learning more about USLCA, let me know. What other board members do we have on the call? I know we have a few that are going to be running a little on the late side. All right, it looks like that might be it for the moment. So let's go on to our 2023. I'm proud to announce our 2023 Board of Directors. I'm staying on as chair, and Tina, our past chair, she actually will not be continuing in this role because of the busyness of life. So that actually will be open. Mark is going to jump into the secretary role. Thank you so much, Mark. Treasurer, we have Tipper Gallagher, and then we have our directors at large, Abby, Corinne. Now help me pronounce the name. Zabraka?
Zabraka.
Ah, awesome, awesome. Shukri, is that correct? Steph, Dr. Chip Martin, Kylie, and Chris. And then we also have another one as well, and that is Shoshana, who is our current secretary. She is staying on as a director at large. And if you are on this call, go ahead and put your video up and introduce yourselves.
Hey, can you hear me?
Yes.
This is Kylie. I'm also in the car. I'm a public health nurse in IBCLC in Faribault and Martin counties currently. glad to be here.
Welcome. Excited to work with you.
Good morning, everyone. My name is Zabrica, Zabby for short. I am a breastfeeding peer counselor for Hennepin County WIC and Sherburne County. And I am also pursuing on the pursuit to become an IBCLC with my internship starting at HCMC this week. So I'm very excited to be here and I am looking forward to working with you all.
Fantastic. Welcome. Anyone else?
Hello. Hello. I'm Chipper Gallagher. I'm a lactation consultant. I'm BCLC, formerly from Hennepin Healthcare. I am now a PhD candidate at the School of Nursing at the U of M, and I'm looking specifically at in-hospital breastfeeding support for my dissertation. And I also work for the milk study at the U of M as a study coordinator.
Awesome. Welcome. And thank you for agreeing to be our treasurer. Lindsay, our current treasurer, is very excited to meet you and work with you. So thank you, Tipper.
Hello there, I'm Chris Scott, one of the directors at large, and I am a retired RN after 50 years of working and have focused mainly on mother-baby care during my career. And am a one-time IBCLC, currently a CLC, and my most recent job was working as the first donor coordinator for the Minnesota Milk Bank for Babies.
Fantastic. Welcome. Do we have any of our other new members on the board on the call today? Sometimes it's hard to see looking at some of the names and whether or not the names are attached to the phone numbers. Well, I just want to thank our outgoing our board members on our board of directors. They've all been fantastic. I'm going to flip back to that. So Melissa, Akmiri, Jeannie, Anne, and Lindsay and Tina have all been fantastic, and they've all contributed immensely to the growth of Minnesota Breastfeeding Coalition. So I can't thank them enough for all that they have done. And everyone is planning to continue with the Minnesota Breastfeeding Coalition in some manner, whether it's on a committee or subcommittee, working on our social media and other various things. So they're still going to be involved, which is awesome. So I'm very appreciative of that. And welcome again to our 2023 Board of Directors. So now we're going to go into our financial report. Allison, do you want to take it away?
Yep, I will take it away. So this gives you kind of a snapshot of financials for MBC. The majority of our income is from grants and project-based grants and initiatives. So you can see the top, we brought in about $98,000 of income over the last year, and then our expenses were about $149,000, the bulk of that being projects and then contractors. And we do have a couple of contracts and grants continuing into this coming year, 2023. And a lot of the focus, I think, for the next year or two, especially, is developing kind of general streams of income for the organization and looking for more grants that focus on growing nonprofit organizations rather than project specific, just to help develop the coalition and get us bigger and better.
Anyone with questions regarding any of this? I know for me, I don't have a lot of history regarding grants. So if you do have questions, feel free to ask, or you can contact Allison after the meeting as well.
Allison, there's one thing missing at the bottom on the slide. Does that just mean increase of 3,000 since 2022 or 2021 maybe?
Yeah, yeah.
Okay, thanks.
Do you want me to forward the slide, Allison?
Yeah, yep.
Okay.
And our next report comes from the governance subcommittee, and this was submitted to us by the committee. And their role is to oversee board orientation, so new members, which we're starting to work on that for all the new board members that are here. Collect annual conflict of interest documentation and develop and review policy and procedures, charters, guidance documents, kind of the business of MBC and how we do business. They're currently reviewing charters, policies, and procedures to accurately depict MBC operations, in addition to aligning with current bylaws. So they kind of do a lot of the work behind the scenes with the mechanisms for the organization, kind of legally keeping us in line with bylaws and charters and make sure we're being consistent in our policies and procedures. And if I sound weird, it's because I have a cough drop.
Say, did I see that Carrie joined the meeting?
I'm on the call. I'm planning to do the membership update.
Okay. Wasn't sure if you had anything to add to the governance report at all.
I'm happy to answer any questions, but I don't have any additions.
Excellent. So Carrie, if you want to take it away,
I can step over now.
Yeah.
Yeah, I'll just share my screen. We our membership team has a few slides. So traditionally, the Minnesota Breastfeeding Coalition has been, a coalition of coalitions, and you can see on this picture from our website all the dots that are points of cultural, local, regional, and tribal coalitions across Minnesota, and that really is the heart of the work that we do, is bringing together coalitions that are working in different regions and in different cultural capacities, and bringing them together so we all have that kind of statewide mission and statewide voice. So we're so glad to have 24 coalition members as a part of our statewide coalition, and so you can see the names here of our coalitions and the link there on our website. So if you are the main contact for your coalition, you should have received an email that it's renewal time for membership coalitions. And so those are due January 1st. And thank you so much. We've already received a third of them back, have renewed. So thanks so much for the support and for acting on those renewal reminders. We're doing things a little bit differently. So about a year ago is when we transitioned to having our wild apricot system that we were using for events also manage our membership. So we're in the learning curve phase of that process. So we thanks for your patience as we kind of navigate that new system, and please reach out if you have questions or if there's things that are kind of confusing or need tweaked, because we're still learning. But we do have the ability to then add in as many name and email addresses for the members of your coalition, so that they also get the same benefits of that main contact for your coalition. So please, if you haven't already provided those names and email addresses to us, please send those along so we can make sure that everyone in a part of your coalition does have access to the member benefits. And so that includes things like reduced rates for registrations for events. And so on your coalition renewal reminder email, we did include the name of the folks that you provided for your coalition. But if there's any changes or additions, or some we don't have any additional members listed yet, so please send those along so we make sure to include everyone. And then with our updated bylaws last year, we did expand the membership categories. So we added in individual members, so you can be a part of your coalition and get membership through that avenue. But if you want to add additional support to the coalition, or if you're not participating in a coalition, but you want to be a member of MBC, there is the opportunity to join as an individual. So we currently have 16 individual members, so we're hoping to grow that area. And then we also added in the nonprofit and business categories. And so we do currently just have one business member, but we would love to expand those groups. So to get, more commitment from organizations who are, want to be lactation supporters and support the work of MBC. So if you know of, nonprofits or businesses that would be great fits, help us connect with them to become members of MBC. And then, with the one important caveat of that we would only work with WHO code compliant organizations. So no organizations connected to artificial human milk industries. So if you are interested in joining the coalition as an individual member, or maybe you're a part of an organization and you want your nonprofit or your business to be a member, there's a link here and I'll put that in the chat. So please reach out and join us. And if you are a part of a coalition member, but you want to strengthen your support to MBC, we'd love to have you as an individual member. And then we also would love to have you join our membership subcommittee. So we are a small team of 3 right now. Maggie Domsky has been holding the reins for many years, doing the hard work of navigating all of the coalition renewals when we did things kind of the old-fashioned way. And now we're transitioning to using Wild Apricot to help streamline for us, but we would like to continue to help support our coalitions across the state. And so we are looking for folks who are interested in helping opportunities for those coalitions. So please reach out if you're interested in joining the membership subcommittee. Thanks so much.
I do have a question for you.
Yeah.
Are all the counties in Minnesota represented in the smaller coalitions?
Not quite. So we have this map here. And so, there are some big regions that are covered by little dots. So like the Northland, for example, their breastfeeding coalition has a really large geographic area, and just this one little dot on the map. But we, I think it's over kind of on the western side of the state, and then towards the top that we don't have as much coverage. So if you're in that area and you want to start a coalition, reach out. And then, I can kind of look at if there's a way that we used to have a map where we had all of the coalitions kind of colored in if we had representation. We don't have that, but I'll work on updating that because that's a great idea for us to kind of see where we have gaps and which areas we want to, continue to support coalition growth.
Thank you for that. Anyone have questions? Allison, I'll let you take it over again.
Yep, I'm taking it over.
Oh.
So the Workplace and Childcare Policy Committee, these are the work they've done over the last year. They developed an active support of the 90-day challenge, developed the curriculum, advised the former executive director on 90-day challenge kit items and implementation. And they directly supported participants during the challenge by hosting Zoom office hours where people could ask questions. They developed and implemented a childcare survey in Ramsey, Hennepin, and Dakota counties. Their survey helped MBC learn more about the landscape of childcare centers and how they interact with breastfeeding families. And lastly, they hosted an interactive roundtable in January, which just generated dialogue and action items for the committee to consider for future planning. And I do know for this committee, they're kind of been on pause for a little while. Their leader had to step down due to life and other busy priorities. So if anybody's interested in kind of helping to kind of re-energize that, they could reach out to me. And then this is the Equity and Access group, and they didn't have much to update from last year. It's the subcommittee has oversight on MBC activities to ensure inclusiveness in activities, including the BIPOC community. And I believe both leaders are going to continue on, and they are looking to meet. I just heard from them. I want to say they want to probably meet in January, since once it hits November, nothing really gets accomplished in Minnesota. So probably January. And next, we have the Next Gen group, and the Next Gen Lactation furthers MBC mission of working collaboratively to create environments where breastfeeding is valued and supported to achieve natural infant feeding equity in all Minnesota communities. And then I had a brief report. We have an individual who is kind of managing the students in the program, and the current cohort is doing well. And we have 2 more internships that start this fall and 1 who's moved on to take her test. And kind of my role with this group is to kind of get organized and get a consistent set of policies and procedures moving forward, so that when we do have new students or new interns coming in to continue their education, the path is clear and concise. And then this slide is all about how do you join a subcommittee, and really you just contact me. You send me an email and say, I'm interested in more about any of these committees. Our current committees are on the left side: awards, equity and access. We do have an event planning committee, finance, governance, which someone told us in the chat is our sexy committee. So, take that. Membership, nominating and strategic planning. And then Kim, did you want to talk about the new not proposed, but just the new committees people can join?
Yes. So on here, you'll see we want to focus in on obtaining grants and fundraising. The only way that Minnesota Breastfeeding Coalition can do the work that we do is by having funds, and kind of keeping the lights on, but also making a positive impact in our community. And like I said earlier, I don't have a lot of experience writing grants, and I know that there are people out there that do. So if you are one of those people that are interested in grants and fundraising, I would highly encourage you to jump into those committees. And then we also want to do something as far as advocacy. Corinne, I'm going to have you say something about that if you want, if you're able to.
Absolutely. Is now a good time to share about paid family and medical leave just very briefly as well?
Absolutely.
Great. So my passion for all of this stems from the fact that I have been part of organizing for paid family and medical leave about since 2018. Some professionally, I was an organizer with Isaiah, who is one of the co-chairs of the Minnesotans for Paid Family and Medical Leave Coalition. So the advocacy committee is going to be focused on different ways that we can change policy, more broadly statewide to be more breastfeeding friendly. And paid family medical leave is a big one. Studies show that breastfeeding initiation rates are up to 3 times higher among birthing parents who get 12 weeks of paid leave versus those who get fewer than that. And up to 3 times more people are still breastfeeding at 6 months if they had initiated, if they had 12 weeks of leave. So the benefits are, consistent even after those 12 weeks of leave are up. So policy makes a really big difference. Paid family and medical leave has been a policy that we have been working on in Minnesota for a very, very long time. So I've been involved since 2018, but the coalition of organizations that MBC is a part of has been working on it for much, much longer. I just put a link in the chat to the website for that organization, and it includes detailed legislation for what the policy would be. The upshot is that it would be a statewide program required of all employers, no matter the size, and available to everyone, no matter if they're a part-time or full-time worker, 50 to 95% wage replacement. It would be both caregiving and medical, and one version of the policy offered up to 18 weeks if you stack caregiving and medical leave as a birthing parent. I mean, can you imagine like guaranteed 18 weeks of parental leave and what a difference that would make in terms of breastfeeding rates? So passing this legislation has been impossible. We are a 501c3, so I will not go into detail about exactly why it's not been possible up to this point, but the recent election means that a lot is possible. And in fact, paid family and medical leave is one of the top priorities heading into this budget legislative session starting in January. And so starting in late January and going through early May, we're going to be looking for folks to testify both as experts and from personal experience in support of paid family and medical leave. There will also be moments to show up for big rallies and for press conferences. And so my plan for the advocacy committee, if any of this interests you, is to have a sort of broad, y'all come kind of interest meeting in either December or January, and then have a couple of info sessions about testifying in January, and then communicate about these opportunities as they arise, and hear about what other things that you all would want to advocate for in terms of breastfeeding accessibility for all. Kim, does that cover it? Anything I missed there?
No, that sounds so great. I'm super excited about this committee and just some of the things that we can do out in our community that will make a positive impact. And the fact that you're leading the charge. Super excited.
I'm excited too. Thanks so much.
Yay. So if anyone is interested in joining one of these subcommittees, Allison is going to be sending out more information in our newsletter, but also being able to have something on our website that you can apply and join those committees. And no matter if you have small amount of time, large amount of time, whatever you have ability-wise to donate to the Minnesota Breastfeeding Coalition is so appreciated, because we know everyone's time is valuable, and so thank you. Thank you. Allison, do you want to say anything more?
Yeah, the only thing I also was going to say is I am creating just a form that you can fill out on the website. So you can just click all the subcommittees you're interested in joining, and I'll get that email.
Next on our agenda is the 10-step learning collaborative. And Carol, are you on?
Yes,
on
I
the
am.
call?
Yes, I am. And
Yay.
I will screen share. Can you let me know if you can see this? All right, are you able to see this? Okay, so I'm glad to be here today and briefly want to share about the 10-Step Learning Collaborative. I am one of the contractors. The 10-Step Learning Collaborative is a Department of Health or a CDC, Department of Health, MBC grant, and we are in the 5th year. I'm an RN. I've been in IBCLC for 30 years, although now I have let that lapse. But what is the grant? It is working with hospitals trying to improve infant feeding practices in the hospital. The 10 steps are from the World Health Organization's 10 steps for successful breastfeeding. And we know that's better health for mom and babies. It's evidence-based care. And it's the actual collaborative is a quality improvement learning community where there's networking within the community. We have monthly Zoom calls and I meet with a team lead from each of the hospitals. So currently, there are 3 active teams that are working on achieving recognition through the Department of Health's Breastfeeding Friendly Birth Center Recognition Program. And remember, this is a 10 steps. So if you have met qualifications for 2 steps, that equals 1 star. You can go to the Department of Health's website and see hospitals throughout the state. Needless to say, in hospitals, this has been a challenging time for everyone, but also the pandemic with many competing priorities, staffing challenges. And so I recognize Centracare, Northfield Hospital, Lake Regions in Fergus Falls for the excellent work that they have continued to do. So between the 3 of them, they have completed more than 12 steps and over the past several years, and they continue to work onward. They are doing amazing work. And now there's been kind of a collective catch your breath, looking at priorities for hospitals. So we have had a lot of communication, over 100 emails, contacts with individuals at hospitals and freestanding birth centers throughout the state, trying now in the last year of the grant to increase what work we are doing. It's a challenge to find the right point person where our emails are blocked or individuals changed, but we are working on that. I've also in the past, as part of this grant, had a table display at the annual meetings for the Minnesota Perinatal Quality Collaborative, Minnesota Association of Women's Health, Obstetric Nurse, Neonatal Nursing, and the American Academy of Nurse Midwives conferences. I've participated in planning committees, Zoom support for MBC workshops, Perinatal Leadership Summit, World Breastfeeding Week, lunch and learns, and presentations done. So then that's all that's happened. So this next year, it's the last year of the step, and that includes follow-up and engaging new teams. We have several that have expressed definite interest, and we're excited about that. This is a picture of the Minnesota Breastfeeding Coalition's display most recently last week at Minnesota Academy of Certified Nurse Midwives Optimal Outcomes Conference, and good conversations about what is going on in the world of individuals that were there. I have to say that the collaborative really has been working with Greater Minnesota, and it's exciting to see the work that is being done there. Here's my email. If you have further comments you'd like to email me, questions, you can, and or if there's any steps now or questions now.
Carol, I actually have a question. So this is the last year of the grant. Is this something that we would like to try and continue if at all possible?
Mm-hmm. You know, the grant proposals, as I understand it, and what is planned next will be coming up I know someone at the Department of Health is a point person for that and reports back to the CDC. I'm not sure what will be next, but as we know, breastfeeding has been part of the White House work, and with everything that has gone on with the challenge of formula, many people are saying this is work that needs to be done. Support for parents who are lactating, support breastfeeding, chest feeding support. So it's open for the future. I'm not sure what will happen next. The grant does go through September. So if anyone is interested in hopping on and beginning the work, the Minnesota Department of Health's program, of which Carrie Klun is kind of the point person for that, will definitely be continued. But the collaborative is helping teams say, what do we need to do? How do we measure? We think we're doing something really well skin to skin, but unless you measure it, you don't really know. Just like I think I'm driving at the reasonable speed, but unless I look at my speedometer, it's like, oh, I'm too fast, or whatever. So it's how can we improve the care at the bedside? I don't know if that answers it, but other comments or questions? Great, thank you.
Thank you, Carol. I know that there are hospitals that would love to be baby friendly, but as that's a little bit more of a stricter process, that this is a really great option to do that.
And if you look at the Department of Health's website, and maybe Carrie can drop in where this program is, it's flexible through the Department of Health. It's not all or none. There are no fees associated with it. And the collaborative just helps support this process for organizations to improve their care. Thanks, Carrie, for putting that in.
Thanks for all your work on this, Carol. I know being part of CentraCare and being part of this process, your leadership has been amazing. So thank you.
Thank you.
And I don't know about those that work in birth centers and hospitals and such, with the formula shortage that we had going on, we were seeing more parents wanting to lactate. And being able to support them in that process was really important. In the chat, there is a link as far as an informational webinar about the 10-step learning collaborative, an MDH 5-star recognition system. Next, we'll go into our infant feeding survey. We're making really good time on our meetings today. We're getting through things really quick. So I'm hoping Marcia is on.
I am hopefully sharing my screen and you can hear me.
Yes. Yeah.
All right. And I'm gonna look like I'm not paying attention because I have to turn my head to see what I'm doing here. So yes, I'm Marcia McCoy, and this topic is really closely related to the one that we just talked about, because we're talking about infant feeding practices in hospitals and birth centers. So I'm just giving a little bit of an update of an ongoing project that's a collaboration between the Department of Health, which is my employer, and the Minnesota WIC program, the Minnesota Breastfeeding Coalition, and I don't have the logo on here, but the third partner is the Minnesota Milk Bank for Babies with Linda Deck. So MBC has conducted, not quite annually, but almost annually, an infant feeding practices survey since 2013. So this last year, 2022, was the 8th survey, and the first one that was done post-pandemic. And this year we added some in-depth interviews with hospital lactation care providers and peer counselors. I'm just sharing one slide from the recent data from WIC, which just kind of was showing that after the pandemic started, we had some, after several years of breastfeeding rates just going up and up, we had some struggling going on, especially in certain communities with breastfeeding rates. And then the second major development was that infant formula shortage in February of 2022. And WIC has seen an increase in breastfeeding initiation since the start of the formula difficulties. So I just threw that slide in. It's not part of the feeding practices survey, but just giving a little bit of update of what we learned from the feeding practices survey. And I wanted to say thanks to Samantha Sandvik, who I don't think is on this call, but she's a student intern with WIC, and she's helped with developing these graphs and things. So we're comparing 2014 to 2022 because 2014 was the other year where we had a really high response rate to the survey, the highest response rate, and kind of just taking a look at what's happened over the past 8 years. So as you can see, the percentage of hospitals that report having a newborn nursery for healthy infants has dropped quite a bit. And that goes along with more newborns are sleeping in the patient's room at night. Really great improvement in that. And also with newborn exams being performed in the patient's room. It seems to be pretty much the norm now in Minnesota that these things are happening this way. And we also had a big decrease in the number of hospitals that are giving formula or formula coupons or formula branded information in their discharge bags. We've gone down from 29% in 2014 to just 4% in 2022. So to me, that looks like a, that might make a really great project to see if we could, Minnesota could become discharge bag formula free. It would be really great because we seem to be close. The part that hasn't budged much is hospitals paying fair market value for formula. And historically, this has been kind of a sticking point with implementing the 10 steps, is that sometimes hospital administration just balks at that piece of it. You can also see that in 2014, quite a few more hospitals were reporting that they were working on some of the 10 steps than did report in 2022. And I think we've seen that with the 10-Step Learning Collaborative, that after a great start 4 years ago, it became really difficult during the pandemic because hospitals were so stretched. And I mean, just a myriad of issues that they were facing, including staffing shortages that still are lingering at this point. But we have just recently seen this uptick in interest in returning to, or perhaps having resources or having time to take a look at turning back to some quality improvement for the 10 steps. And at the respondents to the survey, there were a really high percentage of people that said that they were interested in getting back to work on the 10 steps. The other major piece of this year's infant feeding practices survey is that we added a bunch of new questions about donor milk. This is something that was really not happening much in 2014. And at that time, there were no questions on the survey about donor milk. Those were just added in the last couple of years. And then this year we added even more questions to help determine what's happening in hospitals and birth centers around pasteurized donor human milk. So this slide just kind of shows what the hospitals that are currently using donor milk. At this point, there are 27 facilities that answered the survey that are using donor milk. And these are the criteria that they use for providing donor milk to patients. You can see that, of course, the number one reason is infant's medical condition. But then the second most common would be just if the parent is requesting it. And then third would be the mother's medical condition. One little thing to note is that these surveys do not cover the level 4 NICUs in Minnesota because those facilities aren't birthing facilities. So the very sickest infants in Minnesota are not represented on this graph as much. So some of the key takeaways that we found was that, many of these feeding and care practices have improved since 2014, except for that about hospitals paying fair market value for formula. And the number of facilities that talked about working on the 10 steps decreased quite a bit, although there are, in 2014, there were only, I believe, 2 facilities that were baby friendly at that time. So there were a lot of facilities that were actively working on BFHI certification in 2014. And I think that's part of why they reported doing more work in this area. 87% of Minnesota births in 2021 occurred in hospitals which are now offering pasteurized donor milk. So that's a huge percentage of all the births being covered. And of those centers that do offer PDHM, 89% of them use PDHM with healthy newborns as well as sick infants or infants with sick mothers. The vast majority of funding for donor milk is still coming just out of the hospital budget. There's a little bit of insurance reimbursement. There's a little bit of asking families to pay out of pocket. But mostly it's just being absorbed in the hospital budget. And then the in-depth interviews are providing a lot of interesting perspectives of what's happening from the viewpoint of providers in there were 5 hospitals and 1 peer counseling program that were looked at. So some of the takeaways is that people that were interviewed expressed that if providers would advocate for donor milk more, it would make a big difference in how much acceptance and use there was of donor milk by families that were not familiar with it, because we know that a lot of people are not familiar with donor milk, or even among providers, there's a lot of confusion between informal milk sharing and pasteurized donor human milk. And every single interviewee that we talked to mentioned that cost is a concern and that sometimes they do not recommend pasteurized donor human milk because of the cost involved, and the fact that it's not covered by insurance and people have to pay out of pocket in a lot of circumstances. What we already knew, there is a lack of diversity in lactation providers, and that outside of lactation providers, they're like I mentioned before, healthcare providers have some varying perceptions of pasteurized donor human milk, sometimes confusing it with what we would call informal milk from another mother milk sharing. And so one quote was, I think very few providers actually have an understanding of donor breast milk, whether it's practitioners, whether it's like our regular pediatricians up on the floor at NICU. Lots of times we're hearing things like, oh, it's really watered down. We don't know how many calories are in it, even though it's tested and labeled with the calories. People don't seem to be aware of that. Another thing that we're currently looking at with these in-depth interviews is trying to think about equity in the receipt of donor milk. Who's receiving donor milk, and is it being equitably available to anyone? And so there's kind of 2 levels. One is the policy. So as one person said, it's available to anyone who plans on giving breast milk. So if somebody's plan is a formula feed, then they'll probably be giving formula at the hospital as a supplement, but anyone who's working on establishing supply would be getting donor milk. So that it begs a little bit the question of, is it equitable from the point of view of what's the best health of the baby? I think ideally anybody who needed supplementation in the hospital would have availability of donor milk, even if they weren't planning to breastfeed long term. But there's a lot of issues still with the availability of donor milk, the cost, and just the supply. And then people say, so sometimes if we see a family for breastfeeding and they're being supplemented with a formula, if you ask any questions, they're like, well, we didn't know that donor breast milk would be a better second choice to my milk. So this kind of points out to the fact that, yes, it's great that if parents request donor milk, that they get donor milk, but what about the inequities in how much information people have about donor milk and how aware they are of it? If they're not aware of donor milk, they're not going to ask for it. And so you can have situations that arise that don't seem equitable just because of lack of education. And then in practice, sometimes the practice doesn't live up to the goals of the policy. So a couple of quotes we heard were, I think that there are sometimes assumptions about who is going to end up feeding their babies formula anyway. And so like, oh, well, this particular culture, they often combo feed their babies, so I'm sure they're going to use formula anyway. And so is that family not being offered donor milk or not given the same level of education as some, because of that healthcare providers' assumptions about that family? And another quote said, one thing I have seen is that sometimes the nurses just go in a room and they just assume anyone that looks even like vaguely East African, they will just assume that they're Muslim and then not offer donor milk as an option. So these in-depth interviews, I'd like to thank, if anybody's on the call who did one of these, and just in general, the people that gave their time to do these interviews. It's super helpful, and we're learning a lot from them. So just a quick plug that if you're interested in breastfeeding data, we have lots of information on the WIC website about Minnesota's breastfeeding, including information on all infants born in Minnesota, not just WIC participants. And you can also request specific data, such as a hospital's initiation rates broken out by race, ethnicity, or lots of other data requests. There's a link on the WIC pages for that too. So I guess now I'll just ask if anybody has any questions. That's a lot of information in a quick time.
Marcia, in the chat, there is there's a statement from Mark saying some Muslim spiritual leaders have determined that use of PDHM from a milk bank does not constitute milk kinship.
Yes, and I think that in the in-depth interviews, we did have some people that mentioned that they have developed some handouts that they can give to families that can help with education on that point. And I also think the California Breastfeeding Coalition is doing a webinar in early December that was on the MBC Facebook page that's all about this issue. So
Yeah, this is awesome information, Marcia. I might reach out to you for some more on the donor milk thing. Having written a module about sharing milk and one about donor milk, I learned a lot about the milk sharing, milk kinship issue, and just maintain that you never shy away from telling people about the best practice and the best medical care for their child. And don't make, like you said, don't make assumptions that they would never do that. Well, there's a problem right there when you start saying things like they, but thanks so much.
yeah, well, thanks.
There was
yes, I'm sorry, I was going to say, I'm hoping MBC will be doing a webinar in the coming months more about that issue of educating on the difference between informal milk sharing and pasteurized donor milk and some of these other issues.
I think that'd be a great topic to talk about.
I think there's a lot of room for, based on these interviews, there's a lot of room for some education, and there's some confusion out there.
Then the one other thing I mentioned in the chat was maybe for Corinne. I don't know if Corinne's still on. Maybe that's something we should think about taking on. Oh, she just answered. Maybe our advocacy committee could start talking up the idea that, donor milk especially for critically ill infants with a medical need is a necessity, and insurance really needs to start covering it. My understanding too is if Medicaid goes that route, then a lot of the private insurers will follow suit. So
yes, and there are a few states that already have laws in place for that, so it wouldn't be like we would have to reinvent the wheel. It would definitely be, it would be great if we could advocate for that in Minnesota. And that addresses that equity piece. So, because like I said, every single person we interviewed mentioned that cost is prohibitive, and sometimes they don't want to tell a family about donor milk, at post-discharge if they're convinced the family can't afford it, which is again making the decision for the family, right? Which is not right. But you can see where there's hesitancy to tell a family this is really way better for your baby, and then tell them, but you need to pay, $5 whatever it is an ounce, and to think that family can't afford that, you're just discouraging them by even mentioning it as an option.
Now, we're lucky here in Minnesota that the Minnesota Milk Bank for Babies that they have a plethora of donors and lots of milk available, and Linda Deck might be able to speak more on that. But I know that there are other milk banks in the United States where they are struggling to get donors.
Yeah, and thank you, Marcia, for the wonderful presentation. It was a project that we worked on with two master's students over the summer, and pulling this information together. Yes, there's a lot of information here. And part of it in this discussion is, the use of donor milk, pasteurized donor milk, and truly end of donor milk has grown tremendously. The formula shortage probably pushed that edge even farther, that we saw, especially in, I think it has started in February, mid-February. And we're still seeing repercussions from that. However, we are fortunate, like Kim mentioned, to have a really good supply of milk and powder, really due to the high breastfeeding rates we have in Minnesota. So we have an excellent base to start from, and generous donors who provide a lot of their extra milk to us, to the point where we've not had to do a lot of quote advertising. They find us, or they use donor milk briefly in the hospital for their own babies, and they want to pay it forward if they can. So that's how we get a lot of our donors coming to the milk bank here. And the other part of it, as was mentioned, by Mark, that this is something that we are looking at, how to get this covered by MA and by insurers in this state. It has been growing. Each state has to do it on their own. Unfortunately, it's not. There is actually some federal legislation now being proposed, but state by state, I think there's about 16 of them now that do cover pasteurized donor human milk for medical indications and the infant being covered. So it is an area that there's always work to do, and advocacy is part of it. So it's always great to hear that there's interest in doing that. And the processing fees, they are somewhat similar across the country, but it does allow us to hire staff and train them and provide, just like your blood supply, trained people have to do this work, and we meet licensing standards and accreditation standards as well. And part of it is that we've been growing so quickly that we need to find a larger location, which we will be moving to in 2024. So there's a lot going on in Minnesota, and it's encouraging to see how the use of pasteurized donor milk has grown over the years in hospitals, and that the parents are requesting it because they know what the benefits are of donor milk, of human milk, are for the baby.
In the chat, Mark put in a flyer regarding the bridge bag.
Oh, yes. So when we talk about the availability of donor milk for those experiencing financial need or food insecurity, at the milk bank, we've started partnerships with North Point Health and Wellness, and Shoshana at Craft, if she's on. We've just started another one at Division of Indian Work through her program with Natamasing. But for families who are looking for bridge milk. And this is the thing for those families, once their babies leave the hospital, and this can be 2 to 3 days at discharge, if they should need some bridge milk while their own supply is increasing and experiencing financial need, North Point Food Pantry has what we call bridge bags available there at no cost to the family. They can get up to 10 bottles, just like they would without a prescription. That's the cutoff there. We meet accreditation standards say we have to have a prescription if more than 10 bottles are requested. So at North Point Health and Wellness Food Pantry, which is quite close to us actually in Golden Valley, these bridge bags, which were put together with a grant through the Association of State, Territory, and Health Officials and the Coalition and Hennepin WIC, is a collaboration that is now going and up and running, and families can stop by the food pantry to pick up some bridge milk. They do need to enroll at the food pantry, because just like any other nonprofit food shelf, they are reliant upon getting their funding through participants. So they do need to enroll at the food pantry. And in some cases, you know, if they are having issues with being able to afford donor milk, they may need some assistance themselves, so they can get a food package there for the family as well. So that is available now, and the link will take you to their site and tells you about the hours, the other details that are would be good to know before the family gets there. And then, like I mentioned, there's another program that we just started with something similar through the Division of Indian Work. So,
yeah, I'd mentioned that the survey did say that about 1/3 of the hospitals that do use donor milk will discharge patients with donor milk to take home with them, and the other 2/3 don't have the capacity to do that. So, the more we can expand these bridge bag programs, the more people will have access. I'm going to quick to answer. There were a couple other questions in the chat. First, Barb King asked, what do hospitals see as major barrier to paying market value for formula? Unfortunately, the survey didn't cover that, and the in-depth interviews didn't talk about that. So I'm sorry, Barb. I think that there's a lot of times it's very inflated, the dollar numbers that they're hearing, like they're hearing that it's going to cost a lot of money, which isn't necessarily true. And then Thea asked, was there any talk during the interviews about increasing the use of donor milk related to that class actions lawsuit, which was I believe she's talking about the one where they had some infants that died of, the reason for the formula shortage, which was those infants that got Sakazaki, and the few deaths that happened with that. That was not specifically mentioned during those. I think that the lactation providers just pretty much as a given want to see donor milk, the use of donor milk maximized in the hospitals. But I haven't heard anything specific to the lawsuits or those injuries due to the tainted formula.
The hospitals that are still providing formula at discharge or formula coupons, do you know if those hospitals also had NICUs attached to them, or I'm curious about that.
I was going to say I could find that out. They are guaranteed confidentiality, but I do think that at some point we could look at reaching back out to those people that filled out those and seeing if there's something MBC could do or a local coalition could do to help them stop that practice.
yeah, there was a lot of information that came out through those surveys that we want to go back and measure.
Yeah, we got a lot of contacts for people that we could then invite to the Learning Collaborative. Linda also, there was a question on the survey about would you be interested in, becoming a depot. So those people were reached out for. There was, yeah. The work from the survey is ongoing. There's still more to learn and to work on.
Now, Linda Deck and Linda Kopecki, did you present at the National WIC Association, or where did you present regarding the bridge bags program?
Oh, that was with the National Association of City and County Health Officials. So the first grant that was obtained, the Association of State Area Health Officials, after that grant, Linda Kopecki applied for one through NACHO, the second one, and received additional funding to continue the bridge bag at the food pantry. And in the process of getting it set up, it took a while, about over a year. And going through the process of doing that, she was asked to put together toolkits for so that others could take this program and take it to where they are. And in doing so, it's on our website. I think it's on the coalition website too, resources for, the food pantry toolkits. There's kind of a part 1 and a part 2. So as she was putting all that together, we were asked to present at some of the NACCHO resource, webinars that they hosted. So that is up there now and is available. I think, part of it was in doing so, it wasn't to get to that point of providing bridge bags in the food pantry, took some pre-work prior to that and setting up the partnership and establishing relationships with those who are involved. So I'm in discussions now with a couple of other, possibilities of starting bridge bags, because, where bridge bags or where this donor milk, pasteurized donor milk needs to be is where these families live and are where the babies are born, in terms of the access to it. And I see that being, rather than from the milk bank, which is one site in the metro area, getting 5 or 10 bottles out to families in greater Minnesota, or I think that's just it's not practical. You have to ship it, frozen, priority overnight, and things like that. Getting these bags out and getting this milk out to these communities like food pantries or in the hospitals or distribution sites is what we're would like to see going forward. So hopefully people are interested and take a look at their food pantries. The beauty of the food pantries is that they are familiar with food safety standards and things that we need to maintain here at the milk bank, and to ensure that when our milk is being distributed, that it is done safely.
So I've put a link in the chat for the NACCHO resources or the MBC webpage that talks about these projects.
Barb put a comment in saying it would be interesting to see where hospitals are giving out formula coupons, samples, etc., and whether they have a breastfeeding coalition in the area.
Yeah, and it's on my to-do list, Barb. I would have to reach out via the person that filled out the survey, and see if they would be interested then in connecting with somebody in their area.
Tipper has a question. Is there a distinction made in the survey between providing formula from the hospital, example, to help with the first few feedings at home, and providing formula samples provided by manufacturers?
Yeah, I think that when the question specifically asked about what is included in the discharge bags, so that would be formula samples. I think that's a separate issue from nurses going in the closet and grabbing samples and giving them to a family that they think needs them, which is a different practice and may or may not be part of the infant feeding policy of that facility.
Do you know what when families are discharged from the hospital, what the turnaround time is for them to get into their WIC appointments?
I know that WIC sees people a lot of time the same day. They'll do same day appointments, and they do see babies that are 2 days old. In Minnesota, there aren't a lot of WIC. In other states, sometimes WIC is more like in the hospital, or it has, a clinic that's co-located with a hospital, but that's not so much true in Minnesota. But they can get in awfully early if they need to.
Any other questions for Marcia or Linda, or comments? I thoroughly enjoyed your presentation, Marcia. I like seeing those numbers and seeing where Minnesota lands in comparison. So, and I know that the interviews was a long, process, so appreciate that.
And hopefully I do have a student that's going to work on writing up the findings of the in-depth interview, and it'll take a few months, but hoping to have more information to share in the future. And the charts that I shared today there's going to be 2 informational sheets about the survey that hopefully will go up on the MBC website in the next couple months. so people can see more detail about that.
And in the chat, Mark agrees and he says, great work, Marcia, Linda, and interns.
Thank you. And thanks, Barb.
If no other comments or questions, we'll go on. Our current activities. Allison, do you want to take it away?
Can you share your screen? Boy, those come up slowly. So this kind of gives a general overview, and a lot of this information can be found on the MBC website as well. Working a lot with fostering a diverse medical lactation workforce. Next Gen has a lot to do with that initiative. Breast and chest feeding friendly workplaces. We have a lot of materials of that on our website as well as videos, webinars, and toolkits. And I know we have some toolkits that will be updated in the next few months. And then you learned about the 10 Steps Learning Collaborative for birth centers. So it's kind of like in a nutshell, the general areas we have.
So that really is kind of the end of our annual meeting, but we want to hear from you. What concerns, what things are issues in your practice, things that you're seeing here in Minnesota? How can Minnesota Breastfeeding Coalition, what things can we do to improve? So this is a great opportunity to, if you want to, put your face up on your screen and ask questions, comments, and how together collectively that we can make change. Or is it too close to lunchtime that we're all done? If there are no other,
I have a question. I don't know. I can't,
yeah.
I don't know if my screen is working or not. Can you see me and can you hear me?
Yep.
Okay.
Yes.
Okay. So we at Stearns County were wondering about the breastfeeding friendly health department. And is that happening? Can we reach out to somebody for questions about that? Do you know anything about that?
Carol.
I can share about it. So the Breastfeeding Friendly Health Department is overseen by the Minnesota Department of Health. And so I can email you the contact for that specific recognition program. So I can put my email on the chat. And then if you want to reach out to me, I can direct you to the right folks at the state to help with that.
Okay, that's great. Thank you.
Yeah.
Any other questions or concerns? Anyone do any fun activities for National Breastfeeding Month or World Breastfeeding Week? here in Central Minnesota Breastfeeding Coalition, where I'm located, my neonatal intensive care unit, we did lots of fun activities. We had a 24-hour pump-a-thon, 24-hour kangaroo-a-thon. I had onesies made with fun little things, water bottles that said turning water into liquid gold 1 ounce at a time. And so on social media, it was kind of blasted out by Centricare. So in my NICU, I try to do fun activities just because for anyone who's had a NICU baby and it can be just a little overwhelming and crazy, and trying to make it a little bit more fun. And then the Central Minnesota Breastfeeding Coalition, we had a Lactapalooza, where we had a big group meet at a park, and we had vendors and food and just got together with families. Anyone else do anything fun?
I can just share another reminder that the kind of lunch and learn celebrating different communities that MBC did during August all the recordings are available on the MBC YouTube page. So if you missed any of those or you want to revisit any of them, they're available to watch.
I have a question in the chat about what grants and funding resources that we're looking for. Let's see here, where's the question? Any type of focus that you're looking for and that others can share with you. Boy, we're open to anything, Linda, anything. So I might send you an email with just so we can discuss a little bit more on that topic for sure.
Sure, it just helps to know if there's a particular area that you're looking to focus in or hone in on, you know, to target, because grant opportunities and or foundation funding opportunities may, you know, hone in or look at certain areas. Is there something that the coalition, you know, in terms of what the plan is to work on that could help others know about to funnel your way, you know, in terms of what to apply for?
I think with Corinne being part of the advocacy committee, I think she might have some really good ideas about potential ideas. And then Allison wrote in the chat that MBC is looking to expand general support, memberships, donations, corporate support. Let's see. And then diversify the grants we apply and hopefully receive to develop the organization, as well as project-based grants. And I'm so happy that Allison has experience in grant writing. But we do want to develop that committee so we can get several people or more involved in that. I'm a big fan of the more heads you put together, the better the outcome is. Let's see. Oh, down here. Tammy mentioned that for National Breastfeeding Month, World Breastfeeding Week, they had a party at a playground and a baked potato bar. That sounds yummy. And prizes for breastfeeding families. Way to go, Tammy. How awesome. Let's see here. Kay mentioned that they had a get together for World Breastfeeding Week at a local park in Richfield, hosted by our peer team for pregnant and breastfeeding families. And there were food, games, prizes, etc. Nice job. Love it. And if you have events that you're doing in your community, we can highlight that on our Minnesota Breastfeeding Coalition social media, but also on our website as well too. We want to highlight and celebrate all the great things that you're doing. Anyone else? Please consider getting on one of our committees and working together on some of these projects. We definitely want you and we need your time, your energy, your enthusiasm are also very much appreciated. And if no one has anything else, I will give you the gift of time and we'll sign off early. Oh, Steph mentioned that Methodist is hosting the Evergreen training, April 17th through the 21st. Steph, are you able to unmute yourself to talk? Oh, okay. If you want to unmute yourself to talk about it quickly, but that flyers are coming soon. And is that a CLC course, Steph?
Hi, Kim. Yeah, it's the CLE course. It's the one that's historically been at Fairview, and so yes, you get a CLE, and it's open. It will be open to the community, so it'd be great to have help too with distributing information.
Mm-hmm.
And April 17th through the 21st.
Excellent. Yes, we can promote it. We can also put it in our newsletter, put it on our event page. So if you get that information to Allison or myself, we can do that. Okay.
Great.
And as well as anyone else. It's great to be able to promote those things so that we can increase the attendance and increase the knowledge and expertise in Minnesota. Anyone else have any training or webinars or anything that they're planning on doing in 2023? For Minnesota Breastfeeding Coalition, we are looking at, and correct me if I'm wrong, the event planning committee for MBC, that we're looking for a webinar sometime this spring and then an in-person event potentially in October. Or am I saying that incorrectly? I know, is Allison, are you still on?
Yep, I'm still here.
Okay, I wasn't sure if any updates, because I wasn't able to attend the last committee meeting.
Yes, so you are correct. That is the plan right now. And the committee is looking at speakers right now.
If you have a passion in speaking and you have a topic that you would love to share with the Minnesota community, please contact us. I strongly feel we have great speakers in Minnesota, and we need to tap into those resources. So, and I'm really excited of the potential of having an in-person event. I went to the USLCA the USLCA conference in Virginia in September, and being able to connect with people in person was wonderful. The networking, being able to be in a room where you could ask questions, you could see things, you could, webinars are wonderful too. There's just something different about an in-person conference. If you have recommendations for speakers, please let us know. I know when I went to the USLCA conference, I have recommended several of those speakers to our MBC event planning group to see if we can bring those people to Minnesota potentially. All right, anyone else with comments, questions? thank you all so much for taking the time to be here with Minnesota Breastfeeding Coalition. Greatly appreciated, and keep calm and latch on. Have a super day. Bye, everyone.